Okay, because you have problem with kicking the ball and you can't use your maximum force. The first thing that we are going to check is the tension arc test, and the goal for using this test is to check all the chain from the upper body to lower body to see is there any limitations there, because it's like all the chain and all the muscles or the structure are going to be involved. And we are gonna check the range of motion of your hip to see is there any limitation kind of. Okay, so we are gonna start from the healthy side and we are gonna compare it with the unaffected side to the affected side to just compare. And yeah, can you like lay on the side?
Which side?
And that side, yeah. And I want to fixate here and grab your leg and go to just extension. Okay, see how much is going. Then we are gonna fixate here. Then we are gonna check it for adduction. Then I'm gonna fixate here, doing abduction, and then the rotations. Okay, so can you just change that position? And this leg I want to be straight, and yeah, the position of the head is fine. Then okay, you can see that extension is limited a bit. Yeah?
Mm-hmm.
Okay, then I'm gonna fix here to see the abduction, and again, yeah, you can see that the rotations are limited. Yeah. Okay, we checked both sides and we can see that in rotations and extension there is a little bit of limitation compared to your unaffected side. So for treatment we are going to work on like mobility and increasing your range of motion. Okay, and now because you have pain around here, we're going to do some palpation and to see which structure around this place is affected. And whenever you feel any pain or feeling weird, just let me know. Okay, for the starting part, we are going to cover this area with towel. Okay, then can you lay down on your back? Okay, can you do it? Okay, and I'm gonna cover here, and can you just put your like short wherever you are, like feeling comfortable?
Like down or
yeah, down. Okay. Okay, fine. And okay, we're gonna first start from your CS, and I'm trying to like palpate inguinal ligament around here, and I'm going all the way down to see there's a bony structure here, and upper part of that bony structure is still inguinal ligament. How do you feel? Is it fine?
Mm-hmm.
Okay, good. Then just a little bit here is the abdominal muscle, rectus abdominis, and maybe this one feels a bit weird when I like, yeah, because it's like the part that combine the pelvic, and here is the adductor longus. And do you feel any pain here, or can you cough when I ask you? Like, yeah. Okay, how do you feel? Fine?
Fine.
Okay, good. So, because you were complaining about pain here and mostly on the front side, we're gonna do the Thomas test. And I'm gonna show you first how we are gonna do it. Then I'm gonna ask you to, like, you're gonna like, the knee should like be back like this, and then you have to go all the way to the bed, okay? Then can you stand up here? Then I can adjust the bed for you. Okay, fine. And then this leg is affected, so
Yep.
we're gonna do from the healthy
lift up that
side.
leg.
Yeah, so you should lift this one up. Okay, can you go all the way down? Okay. Now I'm gonna put some stretch here. How do you feel? Okay.
Stretching.
Okay. And then we're gonna do the same with your affected side to stretch the unhealthy parts. Okay. How do you feel?
Feels more like it's tighter than the other side.
Okay, good. Okay. So you can, okay. So because you feel the stretch more on the affected side, probably the iliopsoas muscle is so involved. So we're gonna work on it also on the treatment part, and that was the result of this goal. So because you're complaining about the growing pain can also cause from the hip. So now we're gonna test your hip and looking for any impingement. And the first test that we are gonna do with the affected side is the Faber test. And I'm just gonna ask you to lock your knee here, and I'm gonna fixate here, looking for any pain or
Okay.
no pain. Okay, good. So the second test is Faber, and I'm gonna like putting your leg in adduction and in trying to put some force. Do you feel any pain?
No.
Okay, good. So we can see that there is no impingement or any pain coming from your hip, and then we're gonna go through other tests to see what structure is affected. Okay, now we are gonna do mulligan technique for your hip, and mulligan technique is just mobilization with movement. And for doing it, first we are gonna check the range of motion of both sides to compare quickly. And this is the unaffected side. Just gonna do flexion and internal rotation and external rotation, and gonna check the affected side also. You can see it's a little bit restricted, and yeah, external rotation is also limited. So we're gonna do the mulligan now to see like how much improvement you have in your range of motion. And okay, I'm gonna put this close to your hip as much as I can, and just a bit. Okay, gonna do it with flexion first. And we're gonna do it as much as you feel
Okay.
better. Okay. Okay. Then we're gonna also do internal rotation and external. Okay, and now we're gonna check the range of motion again to see is there any. Yeah, you can see we can go further. Okay, there is much better, the range of motion is much better in flexion, and now you can see that like you can move better. Yeah.
Nice.